patients seeking healthcare services. Independent pharmacies, in particular, play a vital role in the communities that we serve. The Michigan Pharmacists Association applauds the Secretary and the administration for all of the important steps that they've taken so far to improve access and lower costs to life-saving medications. The Inflation Reduction Act, among other things, eliminated out-of-pocket costs for Medicare vaccines and kept insulin copays at $35 for Medicare Advantage and Part D patients. We can all recognize that these are important first steps, but there's a lot of work that still needs to be done. For example, the interim report from the FTC on pharmacy benefit manager business practices yesterday highlighted a couple key areas where policymakers should be examining how we can help continue to lower prescription drug costs. We urge members of Congress and the administration to keep doing the good work that they're doing to investigate the core causes that are making it more difficult for our citizens to receive the essential medications that they need. Our pharmacies strive for every opportunity to serve our patients in an accessible and sustainable manner. Ultimately, this means better access to essential healthcare services, including medications for all citizens, but especially for our most vulnerable patient populations. Lower costs and sustainable pharmacy access is a key component to ensuring equitable health outcomes for all Michiganders and Americans. Thank you again for this opportunity. And without further ado, I would like to introduce John Gross, the owner of J. Gross Pharmacy Group and Executive Director of the Michigan Independent Pharmacy Association. Thank you, John.
And John, why don't you pause for just a second to make sure you can be on all sorts of channels in the news.
Okay.
You need a little bit of time.
Oh, you just signal with a thumbs up when you're ready.
Very dramatic, sorry.
Oh, yeah.
And I'm unscripted, that's not good.
Do you want to give me a recall mic too, and I can put it on the podium?
Oh, yeah, that would be excellent. Thank
Yeah,
you.
it's okay. We have a little bit of time, so that's all right. Very dramatic, you guys. Thank you all
Yeah.
so much for putting up with the news, isn't it? Patrick, right?
Paul.
Paul, I'm sorry. Paul has been very stressed out about the traffic. So Paul did make it despite the rain, which I'm going to say to everyone, as a Midwesterner, I don't think it's that bad. Everyone. You know, a little bit dramatic. So. How's that? Is that okay, Paul? Patrick.
Yeah, perfect.
Yes, Paul. Starts with a P.
All right, we're good.
All right.
Thank you, Eric. My name is John Gross, and I'm the owner for the J. Gross Pharmacy Group and multiple store owner. I have a store just down the road, about 3 minutes away at Flint Family Pharmacy, and also one in Swartz Creek Pharmacy, also up in Clare County, Gateway Pharmacy in Clare, Eagle Pharmacy in Farwell, and Harrison Family Pharmacy in Harrison, Michigan. And I'd like to thank Secretary Sarah for allowing us to have a little moment of time to just kind of say thank you for the work that's been done in lowering the price for the seniors and the population for prescriptions. I know personally, although I'm not on the bench full time, over the years, having to be able to listen to seniors with their decisions on the cost of medications and making decisions on what they were going to be able to get or couldn't get. And now being able to get insulin for $35 a month, and also looking forward to the changes coming in 2025 with the lowering of out-of-pocket costs for seniors is really exciting to be able to share that with the with our patients as that rolls out in the coming months. So also I'm the executive director for the Michigan Independent Pharmacy Association, and would just like to say that the stores across the state, you know, we are here as independents that during the hard times through the COVID and through the recent Rite Aid closures that are going on, we're still keeping our doors open. We're still tending to the patients and being there to make sure that to the best of our ability, we can have our patients continue to get their medications without delay and without interruption. So that's pretty much what I'm going to say. At this time, I want to introduce my pharmacist in charge, my pharmacy manager for the Flint Family Pharmacy, and actual pharmacist, boots on the ground, Brian Holmberg. Thanks, John.
Thank you, John. I want to have a personal thank you for everyone involved in setting up this wonderful meeting and event today. The teams at HHS and our own worked very hard to put all of this together. I'd especially like to thank Eric Roth of MPA as well as GHS for accommodating us here today. It's a pleasure to welcome the Secretary to Genesee County. It's so great to be able to discuss prescription and affordability with you. As many know, prescription costs have soared to new heights across the country, and many Americans struggle to afford the medications that they need every day. I would like to commend the current administration on its work to reduce prescription costs. The Inflation Reduction Act has helped many to afford their previously exorbitantly priced insulins and vaccines. It's a great accomplishment passing these cost reductions into law that were previously only administrative rule. It'll benefit many Americans. In fact, regarding the vaccines, I remember many patients that in prior years could not afford updated shingles vaccines and other prescriptions as previously discussed. I know that these patients have now been vaccinated and protected as I've personally taken care of them. I look forward to seeing how these legislative actions, like the Inflation Reduction Act, will reduce out-of-pocket costs for these patients. There's still more work to be done, especially on the front line. I witness this every day. Currently, independent and community pharmacies are under financial attack, and many are at risk of closure. Personally, I'm increasingly concerned at the lack of patient access to healthcare services and the negative impact that that may have on our patients. As many are likely aware, at least locally in our area, currently Rite Aid is closing and exiting all stores in Michigan, with Walgreens following a suit by announcing a closure of many stores as well. Unfortunately, this is a travesty for patient access to healthcare that will need to be addressed, and I look forward to working with the current administration and all of our current and upcoming leaders to solve these problems for fellow Americans. So I want to thank everyone again today. Now I would like to introduce Secretary Becerra. Thank you.
Brian, first, thanks very much for the words, for your work as a pharmacist, for making sure that folks in Genesee County have a chance to really not just get the medications that they need, but trust the voice of someone who's giving them, dispensing those very important medications to them. John, thank you again for playing host as well in terms of the work that you have done as a pharmacist in the past and someone who has opened the door so that so many Americans, Michiganders, have an opportunity to receive the medication they need. And Eric, a salute to you and all the different pharmacists like John who are under your umbrella for the work that you have done. I have to tip my hat to the pharmacists throughout America, all the pharmacies in our communities, especially the independent pharmacies who made it possible for Americans to not just survive COVID, but to be able to thrive afterwards. But for the thousands upon thousands of pharmacies, and again, the independent pharmacists out there, most importantly, but the pharmacies that are out there that made themselves available so that people wouldn't have to travel miles to get to a hospital or a particular doctor to get their vaccines under COVID. How many lives are saved, we'll never totally know. We just know that there are Americans who today are back at work, caring for their families, going to school, because there were people who opened their doors at a really difficult time for us in this country. And so again, a tip of the hat, Eric, to all the pharmacists, and John and Brian, thank you very much for hosting. What do you say when an American today who was on fixed income, Social Security, for example, would tell you, yeah, I'd love to get that shingles vaccine, but I can't afford it. There are a lot of seniors in America who can't afford $400 to get a vaccine. So what do? They roll the dice and hope that they don't get shingles. If you've ever had shingles, and I know, Brian, you could tell us about that because you've had some patients and others who've gone through this. It is not something you want to experience. You do not want to play or gamble with shingles. Not if you don't have to. Today, no money out of pocket is what you will pay. No money out of pocket to get your shingles vaccine. That applies to the flu vaccine. That applies to the COVID vaccine. It applies to a lot of those preventative vaccines that because of President Biden's new lower cost prescription drug law, no more out-of-pocket expense for those very important, indispensable vaccines. Not just that, But as you heard, I think Brian mentioned as well, $35 for insulin today. That is something that's saving hundreds of dollars for people over the course of a year. Those who need it to stay alive, who have diabetes. And that's not where it ends. The president's new lower cost prescription drug law, the Inflation Reduction Act, is also capping how much you pay out of pocket altogether. I think, Brian, you mentioned that as well. Starting next year, it's going to cap it so much that no American on Medicare will pay more than $2,000 out of pocket. Some people are going to say, $2,000, that's still a lot of money. If you're a cancer patient, if you're a patient who's got cardiovascular disease, if you've had a stroke, then you know what your medications cost. Tens of thousands of dollars. Starting next year, no more than $2,000 will come out of your pocket. That's going to be a major savings for millions of Americans. Doesn't stop there. In less than 2 months, we will announce to everyone our negotiations with the 10 most expensive drugs in the Medicare system. Only 10 drugs, you'll say, but just those 10 drugs alone cost the Medicare program, cost you and me as taxpayers, cost Medicare beneficiaries $46 billion in 1 year. $46 billion for just 10 drugs. Those 10 drugs, we are now under law as a result of President Biden's new these 10 drugs either to stay alive or stay healthy. That's what happens when you fight to lower costs in healthcare for Americans. But the good thing is what happens when people discover that they're now able to afford their prescription medication. The kinds of responses I get. A woman, she was in, when I was in Texas, I met a woman, a Medicare recipient on fixed income, relying on her Social Security, went in December of 2022 before the law kicked in to get her insulin. She said she was accustomed to paying about $117 for a month's supply of insulin. January 2023, she goes in for that month's supply. She walks out of the pharmacy. She looks at her bill. She says, I felt really guilty, so I went back to the pharmacist and I said, you undercharged me for my insulin. And he took a look and he said, no, $35. That's what it is now. And she said, you cannot imagine what it feels like when you get to walk out of a pharmacy like that with an extra $80 in your pocket. It could be life-saving for many people, and it also can make the difference between buying some groceries or having to buy your medication. That's what this is all about. Fortunately, President Biden fought to get this new lower cost prescription drug law in place, but thank God for folks like Brian, John, and Eric who make sure that those better prices are made available to the American people. All of that because President Biden said at the very beginning when he became president, when it came to healthcare, he had 3 missions. 1, to lower the cost of healthcare. 2, make it available to more Americans. And 3, make sure they had better benefits as a result. So far, lower costs, we just talked about that. More Americans. Today, there are more Americans who have coverage to take their child to a hospital and not worry about going bankrupt than ever before. More than 300 million Americans today have access to a doctor or hospital because they carry their own insurance. Never in our country's history have we had so many people who are insured. 3 better benefits, insulin, $35. Shingles, no copay for your vaccine. Negotiating better prices for those drugs. The president has checked all 3 boxes. Lower cost for more people with better benefits. But we still have work to do. The president will be the first to tell you. We're just pleased that we can announce this and hope that every American realizes do not pay more than $35 for your insulin if you're on Medicare. Do not pay a single penny for your shingle vaccine, your flu vaccine, if you're on Medicare. That's where we got to go so everyone in America knows about the president's new lower cost prescription drug law. Thanks very much, and we'll now take any questions you might have.
All right, guys, let's just go down the line here. Michigan Advanced, you want to start? And could you say your name as well?
Yeah, Kyle Davidson, Michigan Advanced Secretary of Desire. I was wondering if you could speak a little bit more on the public health benefits of making sure that our seniors have vaccines and are able to, access these ways of preventing the spread of illnesses.
Kyle, I'm going to say something, but I'm actually going to let Brian say something because he can tell you what happens when folks don't get those vaccines. Diabetes, you need insulin. You're not going to live if you don't get your insulin. But if you're rationing your medication, which too many Americans do, people are cutting their pills in half so they can extend how long they'll go with those pills before they have to buy the next batch. People are skipping days when they should be taking their pills because they need to make those pills last longer. Peace of mind comes when you don't have to do those kinds of things. That's what President Biden's prescription drug law was all about. It's not just improving health, it's peace of mind. When your child needs to go to the hospital and you're wondering, will I be able to make that rent payment or my mortgage payment if I send my child to the hospital? That is where peace of mind escapes you. But if you know you'll pay your rent and you still could leave your child in the hospital, that's peace of mind. But it's the pain that comes from not being able to make those decisions for your family that really takes the toll. And physically, there's real consequence, maybe real pain, if you don't get the medication that you need. And Brian, maybe you want to say something about that.
Yes, thank you. Yeah, so I can definitely comment. I have a patient story that comes to mind when you ask that question regarding a shingles vaccines. When I look back at prior years in the pharmacy landscape, as Secretary Becerra stated, they were costing hundreds of dollars. I had a patient, one of the first patients I ever saw back in my days in school in the hospital, who actually came in with a case of shingles that was so severe going across his face, ended up going blind in that eye. So it's very nice that our patients no longer have to be concerned of the affordability of these types of preventative services. It'll be a very good thing for our community and Americans abroad. So yeah, thank you.
Thank you.
ABC?
Yeah, just go ahead and come back to me. You can.
Okay.
Yeah.
NBC?
Secretary, I took a phone call this morning from a gentleman that was telling me about his own struggles with healthcare. He said that he had recently put in an order for more medication for his insulin, and they told him that it's back ordered.
Yeah.
And he says, "What am I supposed to do now?" Your response to him?
Yeah, we're hearing more stories about drug supply breakdowns and the difficulty in having a full supply throughout the country. And one of the things we'll tell you is this is why President Biden continues to say we have to be able to domestically manufacture a lot of those medicines here versus try to get the materials for those medicines from places like China, where we don't get to control that pipeline. And the material to make those different drugs is there. It's just getting everything through that supply chain. And what we don't want to see is a breakdown that makes someone like what you just mentioned call you and say, what do I do? There is insulin out there. It's just that sometimes it bottlenecks. And what we're trying to do is avoid the bottleneck, first and foremost, by being able to produce here in America. But secondly, make sure there are no breakdowns. Oftentimes the breakdowns come not because of something physical, it's cyber. The cyber attacks we're seeing more and more come down on health facilities and health networks. Once they break down, because everything's done electronically, you may have the supply ready to ship, but if you can't get on the internet to figure out where you're going to ship it to, all of a sudden it just sits. And so what the president has told us to do are two things. One, work hard to see how we can get Congress to give us the resources we need to help plants be situated here in America so we can produce by the way, we probably invented the drugs. It's just that we don't always manufacture them here. I mean, he's saying we should manufacture here. And secondly, what he's saying is let's make sure that we're ready in the event that there's something physically that happens or electronically that happens that would disrupt that supply chain. Thank you. And tell the first person who called you, if they're having difficulty, they can always, are they on Medicare by the way?
He did not tell me that. He told me he's a GM employee.
Okay, because there are ways to figure out where there are those the supply of those medications available.
CVS, you got a question?
What have been, have there been, some, challenges or difficulties in implementing this?
The biggest challenge, and here again, I think Brian and John and Eric may have some thoughts on this. Biggest challenge is having people know. It's like the woman who walked into the pharmacy and thought, she needed to return some money that she got underbilled. People aren't totally aware of the new law and its impact. So there are a lot of folks who just never believed they could afford to get all of the vaccines that they needed because they didn't have the money. So they've never asked. And unless they happen to hear the word come down that vaccine now is available without charge, they're just not going to bother. And so it's more getting Americans this information, because there are millions of Americans who now qualify to save money as a result of the president's prescription drug law. We want them to know about it. If you're not sure, call us. If you're not sure, check on our website. You'll get the information you need. Or if you're not sure, I guarantee you, a trusted pharmacist like Brian is going to be available to give you some good information. Brian, John, Eric, anything you'd like to add?
Say a few words, just reiterating to the patients that the most costly health care that you'll ever have is the preventative health care that you didn't seek. And that, I think that is one area where we would like to raise awareness about how pharmacists really are one of the most accessible healthcare providers. We can provide here in Michigan immunizations, not just to our senior patients, but to patients as low as 3 years of age. We also play a essential role in the infectious disease state testing. You saw it during the COVID-19 pandemic. Pharmacies were a key access point to assessing whether or not you had the infection even before the vaccine came out. So I would remind everybody that there's no copay to walk into your pharmacy and ask for a better insight into what healthcare services you are eligible and should be receiving. An ounce of prevention is worth a pound of cure, as they say.
Detroit Free Press, and then I'll circle back to you.
Okay, got it. I didn't see that.
Just to be polite, yeah.
No, that's okay.
Or Detroit News, I'm sorry.
Oh.
All good, all good. What do you think about Blue Cross Blue Shield of Michigan dropping coverage recently of weight loss drugs that Medicaid still covers, like Wegovy, Saxenda?
Ooh, so it'd be tough for me to comment on what a private insurer does with non-Medicare or Medicaid patients. But what I can tell you is this. We're seeing what the miracle of medicine can bring, and we're finding more and more medications that are going to really help Americans live longer, live healthier. We should be doing everything we can to make sure that Americans have access to those types of life-improving, life-saving medications. And we have to do it in a way that is affordable for everyone, including the taxpayer, whether it's for Medicare or Medicaid. And so that's what we're engaged in right now, is figuring out how we can make sure no one goes without the kind of healthcare that is now available to them. At the same time, we want everyone to recognize that the best way to make sure you can live a long life is to stay healthy from the very beginning. And so I know everyone standing here would probably say, let's make sure we try to keep our family as fit as possible as long as we can, because there will come a time when we will have to resort to those therapies and those medicines as the last resorts or best resorts. But the whole question about these weight loss medications is how you use them, when you use them, and how much they're going to cost. Who will pay? By the way, one last question on any complications, any thoughts about what's hindering the president's new prescription drug law from really being implemented well? I should have mentioned this drug negotiation, which is the first time in history we're going to get to finally negotiate to get the best price on drugs. By the way, since when is negotiating a bad thing? That's sort of what we do in America, right? You go in to buy a car, you pay sticker price, you look at the price on the retail price on that vehicle and say, car dealer, that's what I want to pay you, is what you're saying it's listed for. And you go in there and say, I looked at Consumer Reports. I did the Blue Book search. I know what to pay. we're negotiating for the first time. So probably one of the uphill climbs here, those 10 drugs, the 10 companies that were negotiating, by the way, all 10 companies are negotiating with us. At the same time, all 10 companies sued us to stop us from negotiating to reduce the prices. So it's not been an impediment because so far the courts have all ruled in favor of negotiating, which I think is as American as apple pie. And so far we're moving forward, and hopefully there's no disruption through these lawsuits, and we'll get to show Americans what we can do with regard to negotiating for better prices on prescription medication.
All right, and now we'll go to ABC. Perfect. Secretary, it was mentioned in the presser here about Rite Aid having issues and shutting stores down. Here in Flint, we're no stranger to businesses closing. However, pharmacy is definitely an important business. And what is the Biden administration doing to focus on not allowing us to gain some of these pharmacy deserts that have been sort of appearing across America?
Yeah. Well, we have invested a ton of taxpayer money in the pharmacy community. When we saw how COVID hit, we knew that pharmacies could be a game changer for us. And we didn't just ask them to do it. We also provided resources to make sure, because it costs money to dispense. I'll let John and Brian, I'm assuming Eric, you know it as well. It costs money to dispense medication. It's not a free deal. You got to, just having your shop there is going to cost you money. You pay rent. You own a building. So what we did was we invested a lot of taxpayer money, you and I pay, so that we could help them be the front lines for COVID. Now they are helping us dispense all these better priced drugs, vaccines, and so forth for Americans under the president's prescription drug law. So we are going to continue to invest in them. Another thing we're doing is we're trying to change some policy, which I think makes life for independent pharmacists more difficult against the big chains. And we don't want to lose John and the fact that he's willing to open up a chain. He doesn't have to be based in Wall Street to open up a pharmacy in Flint. And we think that someone who's living in this community is going to try to do a better job of providing Flint residents with the medication they need than some corporate headquarter in wherever that's looking at what Wall Street's saying every day. And so we're trying to support by policy, not just with money, but by policy, things that allow the independent pharmacists to thrive. We want to get rid of the middlemen that are making it really difficult for some of the independent pharmacists. Right now, these PBMs, pharmacy benefit managers that are out there, that are essentially controlling the market. I say that somewhat figuratively, controlling the market and how the drugs are dispensed and their price. We think that those middlemen who are sucking money out of the system that never actually goes to provide healthcare, provide medicines, really is a disservice to everybody, including the taxpayer. So those are some of the things that we're doing. Resources, investing in pharmacies, and also trying to make sure the policy allows, especially independent pharmacists, to thrive.
If I may.
John, please.
Okay.
I figured I'd spark that.
Oh.
Yeah. Well, I figured. I was thinking that one for a while.
Yeah, so I take blood pressure medication, and it's mainly because of the PBMs. So when Secretary was talking about being able to negotiate, it would be lovely to be able to negotiate with the pharmacy benefit managers who control the pricing that the pharmacies are paid at the store level. And I would encourage people to take a look. The FTC has been doing a 6B study for the last couple of years, just put out a preliminary report yesterday, and just giving a scathing report on how the pharmacy benefit managers have just been creating the havoc of why you've seen an average of one independent pharmacy closing a day for 2023 and thousands over the last years. And quite frankly, I think it's like 2/3 of, in a survey showing 2/3 of independents not sure how they're going to be able to survive another year. And it's primarily the reimbursements coming from the pharmacy benefit managers, and who also determine which drugs are covered and are not covered according to the plans that we have. So yeah, it's a touchy point with me And I know Eric with the Michigan Pharmacists Association and with our MIPA, the Independent Pharmacy Association, I would encourage anyone to reach out to any independent pharmacy, and you mentioned the word PBM and the issues, and you'll have a full story to talk about right there.
What's your thoughts on, seeing something like at that corporate level, sort of, kind of falling down some steps, being an owner yourself of a few pharmacies?
The corporate level of the
Of,
PBM.
like Rite Aid,
So-
of that.
Sure,
style
yeah.
pharmacy.
So the vertical integration and the horizontal integration, the vertical integration of how, working from the, owning the formulary, managing the contracts, owning a pharmacy, a mail order pharmacy, directing and steering where things can go. It would be nice to be able to have patients walk in the door and be able to service them, and knowing that this patient that's coming in who thinks they're a really good customer because they spend thousands of dollars or their drugs cost thousands of dollars are actually costing the pharmacy money, and we're literally subsidizing those plans. We are paying for it. And it's an untenable, unsustainable situation. That's why I applaud what the FTC has also done in digging into this, and the work that's being done in both the Senate and in Congress at looking at these PBMs and realizing the threat that they are for independence, which ultimately results in patient access issues in the pharmacy deserts we talk about. And so there's a reason why the Rite Aids are having problems, and among other things. And there's a reason why the Walgreens and CVSs have closed. And there's a reason why all of these independents that have closed or are closing or will need to close it's a main result of we cannot negotiate with these reimbursements that we're getting, and it's unsustainable.